Now, how do I tell the difference between the different causes of pancytopenia? The major thing to tell the difference between the different causes of pancytopenia is to check a bone marrow. And for most of these disorders, saying a CBC in a bone marrow is a good place to start. I do a marrow. I've excluded infection. I've excluded cancer. I've excluded lupus with an ANA and a B12 and folate, because in B12 and folate, the marrow is packed with cells. Well, how do I know what is actually in there unless I do a marrow? And the answer is that I don't. Well, a pancytopenia, it could be B12 and folate, but I get B12 and folate levels, plus the marrow is packed with cells. Well, I do a marrow, but I can't find anything. I do a marrow, and I find no etiology for the pancytopenia. And then I realize that we have a psychiatric disorder for the bone marrow. We have red cells, we have white cells, we have platelets. The white cells are broken out into B cells and T cells. The T cells can be CD4, which is helper cells, CD8, which is suppressor cells, CD34, which is the stem cell. We can have these other cells called killer cells, T killer cells. Antigens are presented to the T killer cell, and then the T killer cell attacks the foreign substance and removes it from the body. Once upon a time in the bone marrow, the T killer cell wakes up, looks at the rest of the bone marrow, and says, "Who are all you? How'd you get in here? Where are you from? What are you doing in my bone marrow?" One day, the T killer cell starts to have an acute psychotic reaction. And the T killer cell can no longer recognize the rest of the cells in the bone marrow. So the T killer cell says, "You're not from my marrow. What are you doing in here? I don't recognize you, and you're here to kill me. You're here to hurt me. You're going to hurt. You're here to hurt me. What am I going to do?" the T killer cell says to himself. He says, "Well, I could help, but you know, it's not me. I could suppress, but it's just not who I am. I think I'll kill." So the T killer cell wipes out the rest of the bone marrow, wipes out the reds, wipes out the platelets, wipes out the rest of the marrow, and causes a pancytopenia. Now, this pancytopenia, which is basically pancytopenia of unclear etiology, also known as aplastic anemia, is basically pancytopenia of unclear etiology. It's not primary cancer or an infection invading the marrow. It's not drug, alcohol, or radiation effect. It's not a toxin, B12, or folate deficiency. It's not lupus. It's not sequestration. In sequestration, the marrow is packed with cells. In sequestration, it's not any of those things. It's not cancer and infection. It's not HIV and hepatitis B and C suppressing the marrow. It is pancytopenia of unclear etiology. One group of people, you identify a toxin, you stop the toxin, the bone marrow comes back to life. The other group of people have an autoimmune psychosis, paranoid schizophrenia, for the T killer cell. Now, there's two forms of treatment for this. One is 19th century psychiatry. If you're under 50 and you have a match, you should do a bone marrow transplant. And what I mean by 19th century psychiatry is take the psychotic people and kill them. Take them outside and execute and do a bone marrow transplant and reset the marrow. The marrow has to be allogeneic. How can you do autologous? You can't do autologous and transplant your own marrow into you if you got no marrow. Nothing from nothing, leave nothing. So you can't transplant autologous if there is no marrow in you. You have pancytopenia. Now, only 1/3 of patients fit this category. If you're under 50, oh, pardon me, over 50, or you have no match, you have to use medical therapy. If you're under 50 and you're over 50 and you have no match, you have to do medical therapy. Cyclosporine, which is basically an antipsychotic medicine for T cells. It goes to the T cell and reorients the mind of that T cell so that it's not psychotic anymore. And anti-thymocyte immunoglobulin. What if we take T cells and inject them into a horse? Why, the horse would take the thymocyte T cell. If you injected T cells, human T cells, into a horse, the horse would react to it like a foreign body and become an allergic reaction to that T cell. If we inject the human T cell into the horse, same way if we took a horse's T cell and injected them into you, if I inject a part of a horse into you, you would reject that too. The horse now rejects you. Rejected by a horse. Oh my God. And the horse goes, that's not me. Who's that? And the horse makes immunoglobulins, anti-T cell immunoglobulins, also known as anti-thymocyte globulins. And these T cell immunoglobulins react just against the T cell and bring it out of circulation. And all of a sudden, the entire rest of the bone marrow comes back to life because the psychotic T cell has been brought out of circulation. Aplastic anemia means pancytopenia of unclear etiology. All 3 cell lines are down. Hey, CBC with all 3 cell lines are down. I did a marrow. The marrow shows no cancer. The marrow doesn't show infection, TB or fungus. I've got no lupus. I don't have splenic sequestration. The B12 and folate level are normal. Plus B12 and folate give a hypercellular marrow, not an empty marrow. Oh, aplastic anemia. I can stop the toxin. Woo! It's from benzene, and being a benzene taste tester in a carbon tetrachloride factory. Oh, let's stop that. Time to get a new job. Okay, oops, I couldn't stop the toxin. It's a T cell problem. If you're under 50 and you're matched, bone marrow transplantation. If you're too old to get a match, too old to be transplanted, cyclosporine, which inhibits T cells. That's why we use it for organ transplant rejection, and anti-T cell immunoglobulin, anti-thymocyte immunoglobulin, and that's the treatment for these besides the chronic transfusions. That's the management of aplastic anemia, which is basically a psychotic disorder for T cells.